Hi everybody. I wanted to talk to you a little bit about pain medication and pain options for pain. Since the opioid crisis has hit the country, a lot of rheumatologists and general practitioners are afraid to prescribe narcotics for pain, which is generally the most effective way to treat pain. But for chronic pain sufferers, it can be very addictive because you're going to need it all the time. So what gets prescribed a lot of times is Tylenol, which is a joke. If you have rheumatoid arthritis and somebody has asked you if you've taken a Tylenol, then you know it's a joke. It does work for some people, but the majority of people that I've experienced, it doesn't work well. So what you are left with is, Tramadol, and I currently take the 50 milligram tablets, and the way that they're prescribed is take 2 tablets by mouth 4 times a day as needed. So when your pain is uncontrolled, 2 pills every 4 hours is really just enough to kind of cut the edge off. But it's better than having nothing. So that means in any 24-hour period, I can have 8 tablets. What I have left in my current supply is 22 pills. So if you consider I can have 8 pills a day, that gives me 3 days. Oh no, my fingers aren't working. 3 days of pills to last me. My prescription cannot be refilled until Monday. And so today is Thursday, June 11th. So that's Thursday, Friday, Saturday. So Sunday and Monday, I'm kind of on my own. So what I end up doing, and I think what a lot of RA sufferers end up doing, is rationing their pain pills, trying to get by on an amount that will just take the edge off, so they don't burn through their pills and be left with no supply. I use topical creams like BioFreeze or MaxFreeze. I also use, and I'll take a picture of that and put it in here now. I also use a CBD topical spray, and that tends to work on some of the muscular or tendon pain better than really getting down into the joint pain. And I'll show you which oil that I use, the spray that I use, and I'll put it in here. I also use quite often lidocaine patches, and the lidocaine patches that I use are made by a company called Endo Pharmaceuticals, and there's a generic option that's available that is not worth crap. It's like a plastic sheet of, well, it's a sheet of plastic that is supposed to have lidocaine in it. If your healthcare provider will allow for substitutions, this is the junk that you're going to get. The brand lidocaine patches by Endo Pharmaceuticals has a cotton layer that contains the lidocaine. On one side is the cotton layer, on the other side is the adhesive that you can put against your skin. It's a kind of a time-released, it gives you the lidocaine over time, or the lidocaine over time, and you can wear 3 patches up to 12 hours in a 24-hour period, which means if you have pain in your wrist, for example, and you put on a patch and you wear it for 2 hours, that means within that 24-hour period, you can wear the patch again for up to 10 more hours. So it allows you to kind of pick and choose when you wear the patch. Some people, like me, I might need 3 patches, and you can still take up to 3 patches in any 12-hour period. So I might need a patch on both wrists for 4 hours each. That means that I have just left in my reserve 8 hours that I can still wear 3 patches, and I might choose to wear that overnight to help give me relief while I sleep. And let me put a picture of the patches here. The lidocaine patches from Endo Pharmaceuticals are not cheap. They're expensive. I have Blue Cross Blue Shield insurance, and with my copay, I pay $70 for 3 boxes, and each box contains 30 patches. So $70 for 90 patches. And that lasts me generally a long time. And since I've been in remission, I wouldn't use a lot of them, so I've kind of got a stockpile right now. But I find that since I'm coming out of remission, I'm going through those patches a lot more quickly, because I'm trying to use them instead of taking, sorry, I'm outside and I got wind blowing my hair around. I use them instead of trying to take the Tramadol, so I don't burn through my Tramadol supply. I try to save my Tramadol supply for bedtime or right in the morning when I get up, to help me feel better, since I've been stiff and kind of sedentary overnight. So there are also Voltaren gel that you can use. Some people find relief with things like Icy Hot or Aspercream. I haven't really found those particular topicals to work as well as maybe BioFreeze or MaxFreeze, but it kind of depends on your pain level. So those are, and also ice and heat can be effective for pain. So ice packs, doing moist heat, taking a soak in a tub with Epsom salt can be helpful. Epsom salt helps relieve inflammation. And there are bath oils, or also, I know Dr. Teal's, I think it is, has a line that has Epsom salts with like lavender or different fragrances in a bubble bath, as well as a bath oil. So what I do if I'm taking a soak is I will pour an amount of just regular Epsom salt in the bath water and follow it up with a little bit of the oil, because the Epsom salt tends to dry out your skin, and then maybe a little bit of the bubble bath just for, you know, pampering sake. So you can use those types of things also. Bottom line is, if you're treading water throughout the day and you're just trying to get through, these are some things that you can use that might help you kind of get from moment to moment through the day. Prednisone, if you're on prednisone, it's a love-hate relationship with prednisone. It does cut the inflammation, it does help cut the pain, but the side effects from prednisone can be pretty harsh. So you get what I have here is called a moon face, and if you see how round and swollen, if you've not met me before, this might not look strange to you, but my face is very swollen, so I retain a lot of fluid when I take prednisone. I'm currently taking 13 milligrams a day. I had been taking 20, and so my rheumatologist didn't like that amount, and it was very hard on me to live with that amount, and so I'm down to 13. So 13 milligrams makes it manageable for me. It doesn't make the pain go away, and it doesn't you know, allow me to get up and run around and do a marathon throughout the day. It just makes it manageable. So while I'm waiting for my infusion drug Rituxan to kick in, I'm maintaining the lowest level possible that I can on prednisone. I'm utilizing the lidocaine patches. I utilize MaxFreeze. I utilize the CBD oil, ice, heat, Epsom salt soaked. I mean, I will run the gamut of whatever it takes to make me feel better throughout the day. I hope this gives you some information on what options are available to you, and if you have any options that you use, you can put it in the comments if you'd like. Not every state has allowed medical marijuana, so I currently don't use that. I just use the CBD oil. It does not have any THC in it, so you're just getting the CBD oil benefits without the THC. So that's why I didn't mention anything about medical marijuana. If you're able to use it, great. If it helps you, that's even greater. More power to you. I just don't happen to live in a state where it is considered legal, but shops haven't opened up yet to start selling it. So anyway, I hope this gives you some information on what you can use to help with your pain, and I hope you find this video to be helpful. Take care, everyone.